Lisinopril is used for high blood pressure. It works by blocking angiotensin-converting enzyme or ACE activation sites on angiotensin 1. Blocking the conversion of angiotensin 1 to angiotensin 2 prevents vasoconstriction. Lack of angiotensin 2 causes lower levels of aldosterone and less fluid retention. To compensate, the body increases its renin levels. However, the renin is not effective and overall blood pressure decreases.
Her doctor has prescribed her the ACE inhibitor lisinopril 10 milligrams to help reduce her blood pressure and decrease her symptoms of heart failure and post-MI. ACE inhibitors work by inhibiting the mechanism that the body normally uses to maintain blood pressure.
Angiotensin 1 is an enzyme released into your bloodstream by your liver. Angiotensin converting enzyme ACE is released by your lungs into your bloodstream and converts angiotensin 1 into angiotensin 2. Angiotensin 2 is an enzyme that vasoconstricts your arterial blood vessels and releases hormones like ADH and aldosterone that can raise your blood pressure.
ACE inhibitors attach to the binding site of ACE and block the conversion, which reduces the levels of angiotensin 2 in your body. Lowering your levels of angiotensin 2 vasodilates your arterial blood vessels and reduces your blood pressure to a normal range.
Lowering your levels of angiotensin 2 also means that your posterior pituitary will release less ADH and your adrenal cortex will release less aldosterone. This will allow more sodium and water to pass through your kidneys into your urine.
Reducing the amount of fluid in your body means there's a smaller volume of blood for the heart to pump. By relaxing your blood vessels and reducing the amount of fluid in your blood vessels, ACE inhibitors help to control your blood pressure, which reduces the strain on your heart and arteries.
If you have heart failure or have had a heart attack, ACE inhibitors may also be used to help improve your heart's muscle pumping action. So you may be prescribed ACE inhibitors if your blood pressure is within normal range.
Keep in mind that if the medication ends with pril, that means that it is an ACE inhibitor. Some examples include captopril, ramipril, benzapril, and lisinopril.
ACE inhibitors are commonly used for heart failure, specifically systolic dysfunction. That is when the heart ventricle cannot contract completely, leaving excess blood in the ventricle. Lisinopril helps to decrease the afterload and preload. ACE inhibitors also used for patients who have suffered MI, myocardial infarction, by limiting the effects of the damage that has happened to the heart.
Responsibilities would include to monitor their blood pressure and their pulse prior to administration and every 4 hours. There is a risk for hypotension where their systolic is less than 90, especially when they are on other blood pressure medications.
To get your patient's lab values, you got to monitor their potassium levels, keep an eye on their renal function, which includes their BUN and creatinine levels. Finally, don't forget to check your patient's INO. Your patient's urinary output is very important. Adverse effects of lisinopril include a persistent dry, non-productive cough from the increased bradykinin.
Severe facial swelling known as angioedema, increased potassium levels, risks for hyperkalemia.
Acute renal failure and polyuria may also cause birth defects if taken during pregnancy.
May cause nausea, vomiting, dizziness, and headaches.
Do not take potassium supplements or consume salt substitutes without first consulting your physician.
May also cause low blood pressure.
If you continue to have a persistent dry cough, notify your doctor.
Lisinopril should not be used in children younger than 6 years of age.
Alcohol can increase the blood pressure lowering effects of lisinopril.
Marijuana use can greatly increase your side effects of dizziness and change in your pulse rate and heart rate.
This drug should only be used during pregnancy in serious cases. Talk to your doctor if you're pregnant or plan on becoming pregnant.
High blood pressure? Talk to your doctor about lisinopril today.